Hi, everybody. Let's get into it. So my name is Clifford Valentine. I'm with the Sask IYS team. I'm the manager of youth and caregiver engagement. And I want to start out with acknowledging the land of where I'm at today, and it's Treaty 6 territory. And my people have been here for quite a bit of time, and there's I've understood why we've had a lot of visitors over the years, and how do we create a relationship that is meaningful for all of us in the way that we move forward, and how do we learn to heal some of the challenges that we faced over the years. And so for the work that I do in Saskatchewan, but also the work that I do in my community, is really trying to address some of those challenges that we faced. And so that, welcome to Sask IYS webinar number 2, What is the Youth Hub? I want to introduce Maria Talotta, and she can give us your intro.
Thanks, everyone. So hi, everyone. I'm Maria Talotta. Before I pull up the slides for the presentation, I'll also just locate myself and acknowledge the land that I'm joining from. I'm joining today from Treaty 19 territory, treaty territory of the Mississaugas of the Credit First Nation, and before them, traditional territory of the Haudenosaunee, Huron-Wendat. And I also acknowledge the many First Nation, Métis, Inuit, and other global Indigenous people that now call Brampton home. I was raised in a European settler household, but I have mixed European and Raramuri ancestry. And I just recently learned about my Mexican Indigenous ancestry and reconnected with my biological family. And due to the impacts of colonization, my family, who I'm getting to know, has been disconnected from Raramuri culture. So I just think it's important to consider these things and the ongoing impacts of colonization in our work as we have these kinds of meetings, and to consider kind of the roles of the organizations and systems we're part of, and how they often continue to uphold structures that impact the youth, families, and communities that we serve, and the opportunities we have with initiatives like integrated youth services and all the work we do to create a new and better future in relationship with each other and the land. So thanks for that. I'm going to see if I can share my slides.
And also, just while we have a little bit of time there, all questions will be answered at the end. So.
All right. Wonderful. So I'm going to speak to you about Youth Wellness Hubs Ontario today, but I also want to acknowledge that, I have the privilege of speaking with you about it, but actually this work that I'm presenting to you is not my work alone. It's actually, years and years of effort and input from more than 1,000 youth and family members, policymakers, system leaders, researchers, and other academic colleagues that have really come together to kind of build the Ontario's Integrated Youth Services Network. So I'm just going to give you a bit of overview of our model, and I'll show you a hub video to kind of give you a tour of a hub and let the hub kind of describe their services for themselves. And then during the questions, if you want, I can dive a bit deeper into kind of some of the localized approaches, because every hub is a bit different, which is a really exciting and unique part of our model. So as an introduction to YWHO, which stands for Youth Wellness Hubs Ontario, it was an initiative that was specifically aimed to improve access, outcomes, and service standards for young people, particularly transition-aged youth, in a way that's co-developed with young people, and was a whole of community approach. So in Ontario, we have so many service providers across our province, and it was about working together with existing service providers to find a new way to work together differently to support young people and improve outcomes. And in IYS, that word integration, what does it mean? We all have kind of different definitions of that. For us, it's integration of space, so co-location. Every hub network doesn't necessarily just have one location, depending on the geography that they cover, but in each community, there's one spot young people know they can go to access everything they need. Integration of processes, so as a young person enters a hub network or a hub for service, they don't have to worry about filling out different forms for different organizations that are part of that network. It's all integrated. Young person accesses the services, tells their story once, and the information is shared. Integration of services. So a young person shouldn't know in our model that there's many different organizations, and they're all which organization they're moving to deliver services. So a good example my colleague Joe gives often is it shouldn't feel like a mall where you go to one place and you have to go from store to store to store, but it should feel like a department store where you walk in and there's one person who can actually get you everything, help you find anything you need in that store. And you don't know that they all come from different suppliers in different countries who have different contracts. Like that's not, the young person doesn't have to experience that fragmentation. That's the job of the organization in the background to do that, or the collective, the network. And then shared governance decisions should be made together, and not just with the collective partners working together, but with young people and families and communities more broadly as well. So this is a kind of a diagram of how we're conceptualizing this. And this diagram actually came from my experience with a young person. Her name was Hajar Syed, and she inspired this diagram. We were sitting at an international conference. I don't know why, but it just so happened our table was all Ontario folks except one American who had no idea what we were talking about. And the question was asked to our table, kind of, what does the mental health system for youth look like where you're from? And there was one youth, and then everybody else was either a service provider or administrator or system leader. And all the Ontario folks, you know, the adult allies talked about silos. Our system is siloed, it's fragmented. And the young person said, actually, our system is a maze. It's a maze that I have to navigate. And not only that, I feel like I keep being picked up and dropped in another part of the maze at any given time. It's not just the maze, someone else is also controlling me in that maze. And it was so impactful for me. I said, well, that's exactly what we're trying to do. Figuring out the maze is the job of the system. So that's what the YWHO model is aiming to do. It's bringing service providers together to figure out the maze for young people so that a young person can enter a hub and get everything they need in one space and not have to navigate that maze. The model was developed with and for young people. And so this infographic, or this graphic, comes from one of our very early engagements. There have been many and they're ongoing, and you'll see that as I talk about the model. And youth really emphasize that they want holistic and youth-centered approaches. So they want to be able to bring their whole selves to the hubs, but also get all their needs met. They want to be able to build relationships with other peers. They want to learn skills. They want to get employment services, housing services. They want to just hang out. They want it to just be a safe place to be when other places they're meant to be, like home or in community, don't feel safe. They want to access services, and they want those services to be for youth. They want them to be made for them and with them and to meet their specific needs. It also was co-created with families. So really listening to what family and caregivers were looking for in terms of services, and recognizing that a youth-centered services doesn't mean that family isn't involved. We know through research that, you know, family involvement most of the time is really beneficial for young people in terms of their wellness, except when it's not. Most of the time, that's a really important component. And so the key points that youth and family members and service providers outlined for us throughout our multiple kind of engagements with them ongoingly is that young people need easy and timely access and early intervention. They want us to address fragmentation with integration, offer developmentally appropriate and effective services. Young people want to know when we offer them a service, does this work? Who does it work for? How do you know it works? We have to be able to collect data about their care as individuals, but also collectively to be able to answer those questions for them. It's our obligation to do that. They want youth at the center and families at the center. And they want us to pay special attention to the needs of transition-aged youth, so that those youth who are kind of transitioning into adulthood. And what we've heard, some quotes, is just that it's easy to get lost in the system or overlooked, and that we need to be more youth focused, that youth have opinions and voices and they need to be incorporated. So really the broader YWHO priorities and how they align with system priorities is just really around centering youth, centering equity and access, and improving outcomes with and for young people. So right now, YWHO has 22 networks across 30 locations in Ontario. So as I said, some of those networks, those same service providers cover a vast geography. So they serve more than one community. And the YWHO provincial office and YWHO kind of operates as a network of networks. So as the provincial office, we support our hubs to implement the model with fidelity. Part of that implementing with fidelity means supporting adaptation as needed for the community, because every community is different and the model should look different the way it's implemented in each community. But there are some core components that need to be there everywhere. And so I'll go over those as well. And the provincial office provides that support and more. And we operate as a network of networks also in that, you know, the hub networks communicate with each other and learn from each other. And it's not that the provincial office knows best and is kind of dictating how things go, but that we provide the connections in the platform for our networks to connect and communicate and learn from each other. So what does the YWHO provincial office do? We're based within the Centre for Addiction and Mental Health, which is a hospital in Toronto. We have 3 different advisories that we operate at a provincial level, in addition to the advisories that operate on local levels. So that's a youth advisory, a family advisory, and Indigenous Youth and Family Advisory Council. We actually have now another advisory called the Digital Access Advisory, because we're building some digital infrastructure. And so there's a separate group of folks who are involved in that as well. And we provide kind of support around operations, training, capacity building, and support around equity and engagement. We support the provincial level advisories. We provide education and knowledge mobilization. So, you know, sharing knowledge across the network. Sometimes that comes from network members and we have a platform to share it across the network, or, you know, research knowledge, etc. Training for service delivery for some of the services that we offer within the hubs. Strategy and transformation. So thinking strategically about how are we working together to transform the system of care for young people in the ways that I described to make it less of a maze. Research, communication, data and evaluation. It's also the branding piece. Something else that my colleague Joe says is that, you know, you can take a young person from any province and drop them in any other province. And if they want a coffee, they'll know exactly what to look for to go find one. If you can drop a person from their community into any other community, they're not going to know, and you ask them, where do you get support for your mental health? Oftentimes, the only thing they'll be able to identify is the age of the hospital. And most often, that's not actually the best place for them to get the support they need, depending on the level of care they need. So by having common branding across Ontario, it's really about a young person being able to recognize, no matter which community I'm in the province, I know that if I see YWHO, I know what I'm going to expect when I walk in the door. And it doesn't matter which service providers are coming together to deliver that care. I know when I get there, I'm going to get services that are aligned with the core components, which I'll cover shortly. So the YWHO model, we'll get into kind of the core components here. In terms of transforming our system of care, based on the input that I shared, it's really about early intervention, developmentally appropriate services, effective, so being able to show they're effective with outcome data, and integrated services. A walk-in service model, that was really important for young people. They want to be able to get services right now. Resources that match their need. So how do we support young people to make sure they're getting the services that match what they actually need in that moment, recognizing, you know, that sometimes they need services at different levels at the same time, and that's okay in the hub model. They don't have to move between levels of care. Concretely, they can be in multiple levels of care at once. And then standardization and outcome-based care. So what are the key features of our youth wellness team? There's kind of 2 streams of service. There's the skills and well-being activities, which I think also are, you know, it's not captured in this language, but it's also the relationship piece, the community building piece. And then the youth wellness teams activities. So the skills and well-being include kind of more concrete social services like education, employment, etc., but also community and recreational services. Sometimes coming in and having a space to make art and having art supplies available. For some young people, it's coming in and having a place to do their laundry. I had one young person when I worked in a hub who, you know, at first came in only for a safe place to sleep. He would sit on the beanbag chairs and sleep. knowing it would be safe for him to do that and that he didn't have anywhere else to do that. And very slowly over time, he started to integrate into more activities. After about a month or so, he would start taking food from the kitchen. After that, he would join us for collective meals. After that, he started joining some of the more social activities or playing video games. And slowly over time, he became more and more integrated. And by the time I left that hub, he was really part of the community and actually had kind of small pieces of employment within the hub, supporting interviews for new staff that were coming on board, or being tasked with taking the money to the grocery store and having the grocery list to buy food for a meal that we were preparing collectively. So it really kind of become part of the community. And it was only at that point that he started to access clinical services. It took over a year. So that skills and well-being push is really important. And then for the youth wellness team services, it's mental health and substance use services, as well as primary care. Oops, went the wrong way. So how do we implement this? We have 6 core components. Youth and family engagement. Young people and families need to be part of the design of a hub locally from the very beginning. Integrated governance and partner collaboration. So that when we're talking about integrated governance, that's the decision making for the hub. So that should include all the partners, that whole of community approach. It should also include youth and families. Youth and families need to be part of the decision making. Accessible, any door is the right door is kind of the way we like to think about it. That any pathway that the young person comes into this space should be the right pathway. If once they get there, they should have access to everything they need in one place. And that also includes kind of physical accessibility, thinking about offering services virtually, and other translation services, interpretation services, supports, other kinds of supports as necessary. Culturally diverse services delivered in hubs should respond to the health beliefs, practices, and cultural linguistic needs of diverse youth. So it's not enough to think about, how do we engage diverse youth to get in the door to come access our services, but how are we adapting our services to meet the needs of those young people? How are we finding that out from youth and families and communities? And then who are we partnering with to make sure that we're doing that appropriately? Are there, for example, Indigenous-led mental health organizations that we're partnering with to be part of the hub? Are there ethno-specific mental health organizations? So for example, some of our hubs have partnerships with Punjabi mental health services or Afrocentric mental health services. Integrated service delivery. So it's that example. It's not a mall, it's a department store. The service providers from whichever organizations they're part of, they work together to deliver care together. They talk to each other. And another example, recently I was at a hub and there was a young person who was really struggling and was seeing the nurse practitioner around some of kind of medication management and the physical components to their challenges, and was also seeing the mental health clinician, and it wasn't clicking. And one day the young person was with the nurse practitioner and the mental health clinician was right next door in their office, and they knocked on the door and they all sat down together and they developed a kind of a plan moving forward, the 3 of them in one room. And since then, that young person has been really showing a lot of improvement, has been really grateful for that opportunity to meet with those 2 clinicians together. Those 2 clinicians were employed by 2 different organizations. They happened to be working there at the same time, and that young person was seeing them. Now they do it on purpose all the time. They have those, not just meetings outside of the clinical space, but with the young people together as well. And then measurement-based care. This is about using standardized measures. We know that they're not perfect, but there's some that can give us information about how young people are improving and the impacts for young people around the care they're receiving, and we work to improve them all the time. And then kind of outcomes evaluations, collecting information from young people to improve care. So this is a young person gets an iPad when they enter, when they access the wellness services. So not when they're just doing drop-in for arts programming, when they're accessing the wellness services. And there's peer worker or an intake worker would chat with them about what information we're collecting, why we're collecting it, that when they see the clinician will look at that information together with them, and they'll develop a plan together about how to support that young person and who else that young person might want to see at the hub. Then the clinician looks at that information that's collected from the young person and brings it up and has a conversation with the young person in their clinical encounter, and then that is shared amongst that team of care within that hub, and the young person can revisit it, including their own goals that they develop and how they're progressing over time, and determine alongside the clinician, do we need to change approach? Is this working? Is it not working? And so they're really part of their care, and they get to see their own progress over time, which is really exciting for young people. So our clinical services pathway, just really quickly, a young person will access skills and well-being activities and community and social supports in a hub. There are, most of the time, there's kind of very, very low barrier access to that. So we're not asking folks to fill out kind of clinical information for those things. And sometimes in some hubs, we're working with some hubs now to think about, okay, how do we collect some information in a really low barrier way to understand the actual therapeutic impact of these community activities, right? Because young people are saying, actually, it's coming to the art drop-in every Tuesday that's really benefited me because I've built relationships with young people, with peers, and I'm learning a new skill, and I'm really proud of myself for what I've learned. And then there's kind of the intake, screening, and navigation piece that supports more the clinical services pathway, which includes peer support and care coordination, so a lower barrier access for those pieces, primary care, and mental health and substance use services. I won't go into tons of detail on this piece because it gets really cumbersome, but you can see the slides here, and I'm happy to share them after. And just, that a young person, their experiences, they come in through intake, they access the services they were looking for, they have an opportunity to provide feedback on those services, and then identify kind of what other kinds of supports they need, and then work with the care team to be connected to other relevant services at the hub or sometimes outside in the community. And this is just to say that kind of the continuum of care includes low intensity, moderate intensity, and high intensity services. It's what we're finding is, young people are coming in with moderate to high intensity needs. And so it's the hub's role in that moment to provide those services. If not within the hub, where often the moderate and some high intensity services are provided in the hub, then making those relationships with other service providers and supporting the young person to access those services, while still maintaining supports at the hub, right? So young person, if they enter a more intensive service program, for example, a hospital outpatient program, they don't suddenly move out of the hub. They can still continue to see their peer support worker at the hub. They can still continue to access the groups at the hub, etc. So I'm going to stop talking now because I've said so much, and I'm going to show a little video of visiting a hub. And then maybe we'll end there, and if I can dive in a bit deeper if folks have other questions. Let's see if my video works. Tell me if you can hear it, please. That's my name.
We cannot hear it.
Maria, there's no sound coming out of it.
There's no sound. That's what I was afraid of. Okay, so I'm going to do it a different way and stop sharing this. If I can figure out how to do that. All right. Just give me one moment here and I can share it a different way. Let's see if this works. Let me know if you can hear the sound. If not, I'll just not show the video and show it to you another time, or send you a link when it's up online. Can you hear it or no? Okay.
I think there is still no sound.
Unfortunately, there's no sound, so we'll skip the video. So yeah, I guess we can stop there. I can speak more to kind of some of how the model is implemented locally if folks want, since I didn't get to show you that video, how the core components are implemented locally, what that looks like. The look and feel is different at every hub. I can talk to you more about measurement-based care, learning health system, or kind of our data pieces, whatever folks are interested in. And I guess I pass it off to you to see if you have any questions. And yes, I will share the link. I can show some photos of different hubs as well if folks are interested. I can share the link to that. It's just not up online yet. That's a brand new video, so I don't think it's been posted yet.
So we did have one question earlier, and Tom was asking, so specifically for YWHO with you guys, is there sites that are open 24 hours?
Or even late night, honestly.
Yeah, none of the sites are open 24 hours. Every community works with young people to understand what would best meet their needs. So that means most of our sites are open to young people, usually between 12 and 8. And because our age range is 12 to 25, in order to kind of make that space accessible for the different age groups, because they don't want to be in there at the same time. 22-year-olds don't want to hang out with 13-year-olds, and vice versa. And so they'll have sometimes kind of targeted programming, or some hubs will be open from 7 till 9 for specific programming for older youth. But most of them are open most days till about 7 or 8. And we have and many, but not all, have weekend hours as well. It depends on what the youth in each community want in terms of access. Older youth sometimes come during the day because they're not in high school. So they're either working or they're in post-secondary, or neither, and so they want to come during the day and access supports then when it's a bit quieter. And younger youth tend to come right after school, and then later in the evening there's often programming again for older youth.
I guess I've just found in my life that as it gets later and a lot of support services start to shut down, it gets harder to deal with crisis situations.
For sure.
I was just curious about that.
So we have a couple of examples where that's been the case in communities. So for like access to crisis supports is part of the hub model. So having, integrating crisis supports, community crisis supports as part of the model. So young people accessing the hub know how to access supports when the hub is closed is really important. And then also for different communities. So for example, hubs that exist in big cities like Toronto, or kind of the GTA, there's a lot of housing support services that are really experts at kind of emergency housing, shelters for young people. Not that there's enough of them, but they have expertise in that. So our hubs partner with those organizations and support young people to access services there. Whereas in some of the smaller communities we serve, there might not be any emergency housing for young people, or very limited, or not nearby. And so we have hubs in smaller communities that actually have respite beds on their sites, and partner with emergency housing services to come staff the overnight hours because they have the expertise, but the beds actually exist in the hub. And then they work with housing support workers to, so that should be a short-term solution, just a few nights. So it really is community dependent, because when we're talking about a whole of community approach, what exists in each community is different, and what expertise exists is different. And, the reality is we're facing challenges, as I'm sure you will, in Saskatchewan, around rural and remote communities. When you're talking about a whole of community approach, and really within hundreds of kilometers, there's no access to a particular service, how do you bring those services in, and how do you problem solve around that to be part of the hub? And I think that looks different in each community as well. And it's something that we're kind of working towards together, actually kind of in a pan-Canadian way, to think about how do we do better to support rural and remote communities with this model.
I was going to ask with the remote and rural communities, so I guess how many remote and rural communities that you currently work with, and what are kind of some of the challenges, or how are you guys kind of navigating some of the challenges, like an example of like getting like a mental health clinician in those communities? Has there been challenges around that?
Yeah, I think so. We support a lot of rural communities, remote communities fewer. I think we have 4 hubs that are rural and remote, or 4 networks that operate in that way. Many more that include rural communities. And so far, I think the biggest challenge has actually been primary care. They've been able to I don't know, like even they've been able to find mental health supports, peer workers in all our communities so far. I think the primary care piece, even in the more urban communities, it's been really hard to find nurse practitioners for full-time roles, period. More difficult and more challenging in rural and rural communities for sure.
Mm-hmm. I was also going to ask about, since we're on the topic of like remote and rural, and then you guys are having a digital access advisory now that's been developed. And so how do you kind of envision that, or how is it looking so far?
Yeah, so we are developing our virtual platform. And so ideally, the provincial virtual platform should be accessible by any youth in the province, no matter where they live, whether or not there's a local hub. And it should include the full suite of HUD programming. So there should be drop-in art classes and mental health supports and primary care. And it should be, that being said, that's years out. Like we're at the very beginning stages. We're piloting with 4 communities right now. It's only open to those. It's just launched in those 4 communities, and the services being delivered are the wellness team services. So the mental health and substance use supports. That's the pilot as we start to figure it out. The digital access group is a group of service providers from hubs, young people, and parents and families from our advisories, from our various advisories that have joined that group to specifically talk about digital access and what that looks like from different perspectives, rural and remote, urban, how that complements in-person, understanding young people's choice and how they want to access different services remotely or in person, that kind of thing. So that's what they've been working on. So we're working towards figuring that out, but it's very early stages.
Yeah, like I'm just kind of thinking of some like other cool things of like potentially that could come up with that. If we're talking about different like programming, you know, I think potentially there's probably an option to, if we're doing like arts-based stuff, where it's just like, okay, you know, people who sign up for this, we'll send you an arts kit, and then we'll all go through doing an arts programming together in the comfort of your own space.
For sure, and that's actually happened throughout. So what I'm talking about is like a provincial, but locally that's been happening. So most of our hubs launched during the very beginning of the pandemic, and so how do you do community programming? They had cooking classes. I think this was in Renfrew County in Ontario. I can't remember, but they had cooking classes where the young people who signed up were sent gift cards and shopping lists, and they went out and they got to purchase their food supplies. Then they did the cooking class virtually, and then they ate the food together virtually as like a shared meal. So that kind of stuff happens all the time. All of our hubs do virtual services already. They just do them locally, and they don't they can't book the services virtually, if that makes sense. Young people still have to reach out to their local hub to book the service, and it's young people who are already connected with the hub. So the idea with the provincial virtual platform is that the hubs wouldn't have to manage that. They'd have support and infrastructure to do that.
Mm-hmm. Yeah, so I just feel like there's a lot of options, or a lot of opportunities for different ways of, you know, how to connect to our young people, and also how do we make sure that they're feeling acknowledged through whatever they're experiencing. And then I guess one of the challenges, I guess, nationally around, you know, integrated youth services is family engagement. So specifically for YWHO, how does that look for your group?
Yeah, it is challenging. I think family engagement is I think in our experience more challenging than youth engagement. And people want to be there and they want to tell you what's working, what's not, and they're loud about it and they're blunt about it, and I love it. Families, first of all, it's harder. Like oftentimes families are really struggling with time and like energy to participate. You know, there's a lot of turnover in both with youth and families in terms of engagement. With young people, it's like they participate for 3-4 years, but then they get older and they have different interests, and then so it's like constantly rebuilding those youth advisories. And it's the same thing with family advisories. It's also like the challenge we found is we have really great family advocates, and they happen to be the most resourced families because they're the ones who are able to contribute their time and energy and efforts. They're the ones who are able to take time off work or to just be able to be present in kind of some of the engagement activities. And we are making a lot of efforts to kind of be more proactive and thoughtful of how to engage families who are not as well resourced, and how do we do that in a way we're better at that with young people. We've figured out kind of how to do that, but with families, it's a lot more challenging because families are overwhelmed, like with so many things, not just with supporting their youth. So I think that that's something we're working on and trying to do better on. And, you know, we don't have all the answers, but we're happy to share as we learn, and would love to learn from you folks, who I'm sure many of kind of you folks who are already providing services might be really good at this, and we'd love to hear from you what you do, and so we can do better.
Mm-hmm. Yeah, and I think it's just it's because part of my work moving forward is, you know, one, we'll be working with our co-design team, but then we're gonna have to start moving towards doing our caregiver piece of our work. And so that's going to be another whole interesting process all in its own. So I'm just trying to pick your brain a little bit around some of that. But I was also going to ask about, you know, since we're talking about like services or access for you guys, it's 25 and 12?
12 to 25, yeah.
Okay, and so what about transitions for that, you know, from 25 to 26? Is there any kind of transition process?
Yeah. So I guess the YWHO model kind of is a transition process. In Ontario, we have this age cliff where services are divided for children and adolescents up to and including 17, and then at 18 you move to adult services. But neither the children's services nor the adult services are geared towards youth, right? They're geared towards, like, a 16-year-old doesn't want to be in a waiting room with Lego and coloring books, nor does an 18-year-old want to be in a substance use group with 50-year-old men. Like, neither of them was geared towards youth. And so the IYS model is kind of trying to address that. And so we bring the model as a whole community approach in Ontario should include adult service providers, and in particular substance use services. Like, the children and adolescent system in Ontario is only just now really getting better at substance use services. It hasn't really been providing that, whereas the adult sector is providing it but geared towards older adults. So it's bringing the kind of substance use and addiction providers together, the adult mental health providers and the children and youth mental health providers, to co-deliver services, partly so that young people, you know, if they're connected once they turn 18 with a service provider from an adult agency, then once they turn 26, they already have those relationships with that agency in their community. They already know the workers from that organization, and maybe they're not dropping in at the hub anymore, but they already have those relationships with that one of the organizations that was part of the hub. And then the service providers they build capacity together about how to serve that transitional age youth demographic. And so they all get better at the things that we've been siloed around, right? They all kind of learn each other's processes. So that piece is also really cool.
Yeah. So it almost sounds like it's a soft pass. So
exactly, yeah.
Yeah, Dean, I see you have a question there. I don't know if you want to speak to it.
Well, hi, thanks, Ryan. Ideally, Pam could probably answer, but maybe through an email to everyone, because I imagine it might be a common question that we'll all answer or all ask. Okay. Thank you, Pam.
All right. Do we have any more questions or thoughts that we want to explore a little bit with Maria? Yeah,
Hey,
go ahead.
Hi, I'm Kitsy. I'm actually from BC. We got an opportunity to jump into the webinar today. We're focused on Foundry Central here. I'm specifically responsible for creating a youth hub for an inner city local hub, and we're in the midst of doing that. So a lot of these pieces we're also doing, like advisory tables. And I just, just in response, one of our strategies around getting the right family and youth voices to the table is to look for those community champions. So I'm sure I feel very fortunate. We have, a couple of parents who've unfortunately gone through a lot of hardships in their life, unfortunately have lost one of their children due to mental health, due to substance use. We are facing the opioid crisis. So there's a lot of parents in the community who at times don't know what to do because they're still in the middle of grief, but where they are ready, there's a turning point, and some of them just kind of champion. So we're looking at community champions to kind of sit at the table with us. One of them, I'm very lucky, is Carla Todd, whose daughter was Amanda Todd and unfortunately passed away. And so she's definitely going to be a strong advocate at our table. And I look forward to those conversations. It's also balancing the needs of our community around mental health, substance use, and other social services. But I did have a question for you, Maria, surrounding we have an option to hold the family and youth advisory table together or to hold it separately. And the response I'm getting from the youth is we want a separate situation. We do not want our families there. They feel that they can't necessarily voice themselves. And so we're looking at strategies like, do we have 2 youth representatives on the family committee? That kind of thing. I'm just wondering, Maria, do you have any insight on some of the challenges that can come out of trying to create those tables, and or is there success in keeping them together? Just curious to see what your experience has been.
Yeah, no, we hear loud and clear from young people that they want their own space, that even mixing the family and caregiver groups with the youth groups when it's not their families, like if it's their families, totally don't know. But even if they're not their families, I think the idea is that young people want the space to feel like they're in control, they're heard, they own it, right? Their ownership. That being said, we create opportunities to bring them together. So we have a youth advisory and a family advisory, but for example, we're just starting our strategic planning process as a provincial office. And on that table, we have volunteers from the youth advisory, the family advisory, and our provincial Indigenous youth, family, and community advisory table. So, and that's the Indigenous table includes young people, knowledge keepers, and elders. So that one is kind of generationally kind of mixed. But that's the only one. And even there, the youth sometimes ask for separate meetings to chat with the coordinator without the knowledge keepers and the elders, to like have a youth specific space to kind of center that youth experience.
Yeah, so I think what would be interesting or would be helpful, at least in some of the spaces that I've been in around this stuff, because I was a former young person quite a few years ago. And so, it is important to separate the two, because, youth have their ways of that they want to move forward, but also family need that space to be able to talk about what their experience is. And some of the challenge I think with family is at times they speak on behalf of the young person, but I feel like a part of this work is we allow the caregiver to talk about what their experience and what they're going through around that space. And so some of the ways that we've tried to navigate some of the stuff is that before we'd have like a big meeting or an executive, or that we were, okay, let's come together the day before as a family council, as a youth council, as Indigenous council, and let's share some ideas before we go to the executive to, how do we support each other that way, or just creating that little bit of a pocket of that space where we can come together without everybody all being there.
Yeah, we've done things similarly, Cliff, and I think you're right. I think, as a former youth but now parent, as when I was doing this work before I was a parent, I could really understand kind of the youth perspective of why they didn't want families and caregivers there. But as now a parent, I also really appreciate, Cliff, what you just shared around, like, parents need a space to talk about their experience, and sometimes their experience has a lot of emotions and experiences around their interactions or their relationships with young people that they might not want to share, or even if they want to, they probably wouldn't be very good for young people to kind of hear that stuff, but they should have a space to share that, right? And so I think that's important too.
Mm-hmm. Yeah, and I think that was kind of the challenge with that family engagement piece, is that the trying to navigate, how do I fit into a youth focused initiative with one without overstepping their young person's or young people's experience, but also just how do I validate that what I'm saying is also going to be helpful for other parents and caregivers in this work.
For sure. And I think we're trying to frame it as like, young people are going to do better when their families and caregivers are able to support them best. And sometimes in order to do that, families and caregivers need that support themselves. And that's part of kind of integrated youth services, to support the families and caregivers around how they can take care of themselves and support themselves in their wellness. And in so doing, also support their young people and that they're caring for and their well-being. And so I think having those separate spaces, like in terms of clinically, is important, but also, you know, we want to hear from parents and caregivers what they need from integrated youth services, given, you know, yes, we're focused and centered around young people, and in order for young people to thrive, ideally their families and caregivers are thriving too.
Mm-hmm. I wonder if we have some more questions out into the attendees. Because my next question was going to be about branding. How did communities do that? Because I know for us, we're going to be starting our branding process with our co-design team. So over some of the ways forward that worked for you.
Yeah, so I think there's some ways forward and some lessons learned. I think everyone coming together to understand what the branding is for, and that it's really about young, like I said, young people being to identify where they can get the supports they need and to know what that experience is going to feel like when they enter that space, and to have that kind of, it increases access, really is what it does. And so some of the challenges we had is that as a YWHO kind of provincial model, we didn't have our branding ready when some of our hubs were already looking for branding. And so some of our early hubs like worked with their youth and family advisories to develop branding locally. And then shortly thereafter, our branding got ready. And then that was really hard. Like you can't just then say, hey, young people and families and community who just developed this brand for your hub, here's the YWHO brand, we're going to get rid of yours and put the YWHO brand on. So for some of our early hubs, we're going through a process of like transitioning to the YWHO branding or co-branding, right? So I can give an example. You might have heard of it, actually. The Grove is a hub in Wellington Guelph area of Ontario. They were ready for branding before we were, and so they did, you know, Cindy from the Grove will tell you the story herself, but they came to us and were like, we don't have our brand yet, we're working on it. And so they worked with their community to develop theirs. Then ours came out, and so now it's a co-branding model. So they're the Grove YWHO Wellington Guelph. The YWHO logo is there and the Grove logo is there because the young people in that community made that branding, and it's important that we respect that, right? Mm-hmm. So what I will say is that try to develop that provincial branding collectively early, so that as sites get selected and hubs get selected, they can implement it right away. And then we also allow for kind of a local flavor to it, right? Yes, the YWHO logo is always there, but in each local hub, it says kind of YWHO West Toronto or YWHO Wellington Guelph or YWHO so-and-so, and then they can kind of add pieces to it that make it their own. So the branding is around the hub, the integrated youth service hub, and not the organizations that make up the hub. However, in the signage inside, so at our Renfrew hub, there's huge YWHO stuff outside, and you walk in and there's the logos of all the community partners on the wall as soon as you walk in. So it's clear which organizations are kind of participating and contributing.
Mm-hmm. And Marcy, you got a question?
Yes, thank you. Thank you, Maria, so much for the information. It's really, really fascinating. And thanks, Clifford, for facilitating this meeting today. I'm with the Advocate for Children and Youth here in Saskatchewan, and Maria, I have a question about, with all of the different organizations providing services at the hub, and I loved your example about how, you know, different service providers or different clinicians are able to get together in the same room with the youth to provide service if they're needing sort of more than one. How do you navigate? Have there been any challenges raised with sharing information? And if so, how have the services in each of these hubs navigated that?
Yeah, so we support hubs to kind of figure out a data, what's the word I'm looking for? Kind of data governance amongst the partners. And then, so for example, again, I know this because Cindy tells a story all the time, but the Wellington Guelph hub, they actually worked with young people to develop kind of the informed consent process. And they decided with their youth advisory and their partners that it would actually be implied consent for the service providers that are part of the care team. So only those providing clinical services, not beyond. And so but young people are informed about that before, right? So there's a youth developed, very informative kind of implied consent process, information sheet. Young people understand what it means. It's it's very clear, and they have the ability to sign off or not. And if they don't, then it will be kind of separated and not put into that system. And what's really cool is that the young people actually, what they keep telling us is like, we don't care. Like, this is your stuff. We don't care. We want you to talk to each other to support us better. And actually, like, we give our information everywhere. Now, not all young people feel this way, and not under every circumstance. Absolutely. So I think the key piece is that there's transparency in how those decisions are made, that young people and families are involved, and that it is that, like, informed consent is key, and that it needs to be really accessible, and youth need to be able to opt out at any time.
Thank you so much. That's really helpful. And I agree. We hear that from youth here in Saskatchewan too, that they're just tired of telling their story again and again. So thank you.
Yeah, agreed. And just to build off some of that branding stuff. So for my community, I was part of Access Open Minds, which was a 5-year research project trying to change the way youth use and access mental health services. And so they had their whole branding, national branding stuff. And so for us, I really, when we're developing our youth space and working with our young people, we really wanted to try and figure out their own, like, local identity. And so we actually modified our Access Open Minds. And so now this is the medallion that I have, but a young person actually made this, and so adapted into a lens that was more fitting for our community and for them as well. So yeah, I feel like there's a few different ways you can go around this. But at the end of the day, it's the heart and soul of this work of really trying to understand what young people are going through, what they experience, and what they find as value, and how we can move this forward.
Absolutely. And I think that's exactly what we're trying to do with YWHO, is balance the visibility that leads to access piece, because that's the only reason we do common branding, right? It's that so young people know that they can enter any community and know where they can go for help. It's clear. That being said, we want every hub to make that their own and make, and so a lot of the signage is handcrafted by young people. There's sometimes co-branding. There's like a local spin onto the YWHO branding. And the only piece that is YWHO is the YWHO Timmins bubble. And then everything else that's surrounding the logo is their own, right? So I think that's a really important piece. It's really important that the young people in the community feel ownership over the hub and all the parts of it.
Mm-hmm. I don't know if we have some more questions. If we do, awesome. If not, we can probably close up a few minutes early, because I know most people are probably on their break or lunch. What do they say in government? Silence is what is that? Oh, anyways, there's some government person that I was talking to one time, and they would always say that, like, I take silence as compliance. Hold on, yes. Do we have a question? Okay, I don't think we have any questions. So yeah, thanks, Maria, for taking us through that, and thanks for everybody for sharing some time with us this afternoon. Any more questions? You can, I think, Maria, do we have your info?
If you don't, I can share it. I really thank you for having me, and I'm happy to answer any questions from anyone. And I really look forward to coming back to the next webinar, where I get to learn from you folks about what you're implementing. So that's going to be really exciting.
All right, sounds great. So we'll add your info to the link once we have this live. So cool. All right, thanks everybody, and thank you for sharing some time with us today. And have a good afternoon.
Bye-bye.
Thank you.